In this video, I would like to focus on myth-busting some mild hyperbaric oxygen therapy questions. Clearing up most of the common confusion is really important, and there's a lot of it because it is a relatively new modality with a lot of history behind it. So let's take a minute to clear up some of the biggest misunderstandings around mild hyperbaric oxygen therapy. If you're new to hyperbaric, or even if you've been around it for a while, chances are you've heard conflicting information. Hospital chambers, high pressure, emergency medicine, and then you step into a mild hyperbaric oxygen chamber and think, is this actually doing anything? So let's walk through the 5 most common myths and replace them with clarity. Myth number 1, if it's only 1.3 or 1.5, I'm not getting real benefits. This is probably the most common belief, and it makes sense, I understand that. Most people associate hyperbaric oxygen therapy with hospital and diving injuries, where pressure is at 2.5 atmospheres and above. But here's the key distinction. Higher pressure is not automatically better, it's just different. At 1.3 to 2 atmospheres, oxygen still dissolves into plasma in meaningful amounts. That oxygen reaches tissues that red blood cells can't easily access, especially inflamed, poorly perfused, or metabolically compromised tissue. These mild pressures are enough to firstly improve cellular oxygenation, stimulate mitochondrial function, support angiogenesis and neurogenesis and other repair pathways, and calm the nervous system. Most importantly, this oxygen can increase not only the efficiency but the number of mitochondria in the cells of every organ, which means that the organ does its job more efficiently because it has more energy. So as you can see, you don't need emergency level pressure to trigger adaptive biology. Okay, myth number 2, why wouldn't I just go straight to the highest pressure available? Good question. It's a modern mindset, stronger, faster, more intense must be better. But hyperbaric oxygen isn't like lifting heavier weights. It's a biological signal, not a brute force treatment. At higher pressures, you increase oxidative stress, demand stronger antioxidant capacity, and you can overwhelm detox pathways, as well as increasing the risk of pressure-related side effects. Now, this is really relevant when you have an urgent condition, an infection, or something that you really need to get oxygen in there fast. However, starting low allows your body to adapt to increased oxygen, to strengthen the mitochondrial resilience, and also to improve antioxidant buffering. It also regulates autonomic balance. So progression really matters. Just like exercise, rehab, or fasting, adaptation happens step by step. Myth number 3, mild hyperbaric is just relaxation or placebo. Because mild chambers are quiet, comfortable, and calming, people often assume the effects must be psychological. But the relaxation you feel is not the mechanism. It's a byproduct. The real mechanism is the physics and the physiology of what's occurring when you jump into a chamber. Under mild pressure, plasma oxygen increases measurably, oxygen diffuses into hypoxic tissue, and cellular signaling pathways are activated. Mitochondria receive more usable oxygen. So relaxation helps the nervous system cooperate, but the therapy works even if you're not thinking about it at all. And for those of you who are still worried about not receiving the benefits, please go onto Google Scholar, do your research, find how many papers relate to your condition, challenge, or goal, and I guarantee you that you'll find a lot more than what you imagine. Okay, myth number 4. If hospitals use high pressure, why would mild hyperbaric even exist? Okay, so hospitals use high pressure hyperbaric therapy for acute medical emergencies, such as decompression sickness, carbon monoxide poisoning coming from fires, for example, smoke inhalation, non-healing wounds, severe infections. These situations require rapid oxygen delivery. However, mild hyperbaric therapy serves a different purpose. It's great for chronic inflammation, neurological recovery from strokes, for example, brain trauma, concussion, mitochondrial dysfunction, longevity and performance, great for that as well. Also recovery and resilience. So think of it like this. Hospitals use hyperbaric therapy to rescue tissue. Mild hyperbaric is used to retrain biology. Different pressures for different goals. Myth number 5. How many sessions do I really need? And how do I know if it's working? Many people expect instant results from oxygen. And sometimes they do feel better quickly. But the deeper benefits of hyperbaric therapy, things like new blood vessel growth, angiogenesis, mitochondrial biogenesis, neuroplasticity, neurogenesis, immune modulation, stem cell creation, and so much more. These take repetition and time, and that's why most meaningful protocols involve 20 to 40 sessions, progressive loading, ongoing tracking of sleep, energy, cognition, which is memory, etc., recovery and inflammation. So hyperbaric therapy is not a single treatment, it's a process. So just in closing, almost all confusion around mild hyperbaric oxygen therapy comes down to one misunderstanding. And that is, people think hyperbaric oxygen is about force, when it's really about signaling. Mild hyperbaric therapy doesn't overwhelm the body, it invites the body to adapt. And when applied correctly with the right pressure, frequency and progression, those adaptations can be profound. This is why protocol design matters. This is why starting low matters. And this is why mild hyperbaric therapy has earned its place in modern recovery, longevity, and regenerative health.